I'm super excited to share with you some additional information about sugar and inflammation, courtesy of Netta Gorman, host of the Life After Sugar podcast. You may have caught our interview on social media about how cutting sugar has helped Netta and so many other people feel better in their joints as they move through life. If you're interested in the science, stay tuned because Netta's going to tell us more. Thank you, Netta.
You're welcome. You're welcome. So, yes, sugar is one of the most inflammatory foods, and inflammation can also affect chronic pain. So, what happens when we consume a lot of sugar, and I mean added sugars, in this case, refined and added sugars, is that it causes our body to release insulin and also stress hormones. And these chemicals in turn can trigger inflammation, which is one of the most common sources or common causes of chronic pain. Is that correct?
For sure. Go for it.
Okay, so inflammation occurs when the body sends extra white blood cells to an area of injury or infection, and the white blood cells then go to work protecting and healing the affected area. Right. But when we talk about systemic inflammation in all of the system, then that's a different thing, because temporary inflammation can be a good thing to heal, but systemic long-term inflammation is not a good thing for your body. So what happens is that high blood sugar causes our pancreas to produce insulin, and this high blood sugar can also, has been shown to link to joint pain, and for a few reasons, factors like increased inflammation, as we mentioned, but also obesity, where we have more weight that we're carrying that's more difficult for our joints, diabetes as well, and these are all associated with chronically high blood sugar, and they can have an effect on your joints. And so also this is because high blood sugar levels can lead to an overproduction of what's called reactive oxygen species, or ROS, in your body. And this can also cause inflammation, damage to your cell tissues. But research isn't exactly sure how this happens, but it's sure that it does happen. And I'm sure you feel it in your body when it's happening.
Right.
And there's also more risk of arthritis from chronic joint inflammation, and so high sugar levels have been linked with arthritis and arthritis pain. And so what has also been shown by studies is that eating excess sugar causes the body to produce more cytokines, which are inflammatory proteins. And people with arthritis, for example, can have high levels of these cytokines. So that increases inflammation, and then it makes you feel worse, and it's like a vicious cycle. And so really, to decrease inflammation better than anti-inflammatories is not making your body, not causing inflammation in your body by eating sugar. If you lower or cut out completely the inflammatory food that is sugar, then you're far less likely to get this vicious cycle effect of high blood sugar, inflammation, and chronic pain.
Exactly. Yeah. I don't know if you've read Dr. Fung's book, The Obesity Code. I just love his analogy of don't get more mops when you've got a flood because the faucet's on. Turn off the faucet. So cutting sugar is one way of turning off the faucet. Exactly. Yeah. That's a great explanation. And what else did you want to tell us about, Netta?
Well, I wanted to tell you about how to cut sugar. It's easy enough to say, just cut sugar out of your diet. But for a lot of people, that's myself included, when I first started in 2015, it's a mystery about, well, what do you eat if you cut out sugar? It's in everything. So my tip is to stick to whole, real foods and to go around the grocery store, go around the perimeter of the grocery stores. That's where the whole foods hang out, and to avoid the central aisles where everything is in boxes or packets or cans. And also my tip, to save time on label reading, because, you know, my first trip to the grocery store, I spent, I don't know how many hours picking up boxes and cans and reading the labels, putting them down again. But if you choose whole, real foods, vegetables and fruit and meat, fish or seafood or plant-based proteins that are unprocessed by the food industry, eggs, cheese, fermented dairy, nuts, then they don't really have long ingredient lists. They are the ingredients. They don't have ingredients. And so that is a big time saver, where you don't have to stand around reading labels if you're buying the ingredients that then you can assemble at home to make thousands and thousands of different dishes.
Yeah, I love that. And I do have a question about that, though, because once upon a time, when I taught health education, there were many people who could not afford fresh produce and sometimes even fresh meat. So they did have to go to canned or frozen foods. What would you advise them to do?
And especially these days with the price of groceries, right? Well, yes, actually, funnily enough, I found that my grocery bill has gone down since I cut out all the processed foods, because although they may seem cheaper, you end up buying more because you end up eating more and eating more often because they stimulate hunger. So funnily enough, what I do is, if you buy frozen or canned, then frozen vegetables and frozen fruit are just as good as fresh. And in fact, they end up being more fresh because they've been frozen right as they were picked. And even frozen meat and fish or whatever is can be cheaper, or you can choose the cheaper cuts closer to the bone, for example, and then put them in the slow cooker. And then that makes them much more easy to eat, much more tender. And you can also use plant-based proteins, like, for example, beans and pulses that come in a can. Just make sure to rinse them a little bit, but and to look, you know, some of the cans have some kind of additive and some don't. So see if you can choose the one without.
Right. And I have noticed that some, like, say, frozen chicken breasts do have some added sugars now, which blows my mind. Why would you add sugar to chicken? But
go figure, eh? Which is it's like the first time you check the labels, it'll take a little bit of time. But after you've spotted those products that have added sugars that really shouldn't, then you know to avoid them. And then, you know, I make a beeline for the fresh ones that don't have added sugars.
Yeah. And how often is it that food companies change their formulations?
Right. Which is yet another reason to avoid the products that are created, and they're created in a lab and engineered in a lab, by the food industry. They're not interested in your health. I hate to say it, but they're really not. We as consumers, we have to be our own advocates.
True. What else do you have for us, Netta?
All right. Well, you know, this whole situation that happens when we eat added sugars in a large quantity, and I would include flour with that, actually, because it is metabolized by the body pretty much like sugar is. This whole situation is to do with glucose metabolism in the body. There's nothing wrong with glucose in and of itself. The problem starts when we're producing too much insulin to deal with the glucose, to bring our blood glucose levels down again, too much, too often. So if we have these glucose spikes and crashes, blood sugar spikes and crashes, and then the frequent production of by the pancreas of insulin, then we are keeping our body in a constant state of inflammation. And so, you know, the benefits of cutting out sugar means that this whole this whole situation in your body is calmed down, and your body has time to actually deal with digesting your food, using the nutrients for good things instead of dealing with the immediate problems that our own diet is actually causing. So, well, I'm a big fan of intermittent fasting only because, lowering my sugar level to almost zero means that my hunger levels are calmed down. I don't get hungry as often. So I'm not sort of white knuckling it through the day, thinking I've got to fast a certain number of hours. It comes naturally, and fasting itself also lowers inflammation.
Yes, absolutely. So what's your intermittent fasting schedule like?
I don't have a schedule.
Oh, okay.
I fast when I don't feel hungry, and newsflash, I eat when I do feel hungry. And that is different. Every day is different. But generally, I eat dinner in the evening with my family. It's like a social thing. And then the next meal I would have is probably sometime in the afternoon the next day, and I don't suffer from it. And as I said, my blood sugar levels are stable, my digestion is better, and my inflammation is at its lowest point. No aches and pains, no headaches. All of those things I used to have several times a week. Not anymore at all.
That's wonderful. Amazing. Yeah.
Yeah.
So cool. So before I sign off, is there anything else you'd like to share with us?
All right. So just as a reminder for people who think, why would I cut sugar? It's like cutting all of the fun out of my life. First of all, your fun that you have in life is 100% your responsibility. And if, look at me. Do I look like I'm not having fun in life?
I know. You're one of the most fun people I know, Netta.
And by fun, I don't mean parties every night. I mean just enjoying life, because your body works as it should and your mood is bright, And I want to remind everyone that's watching that cutting down on sugar helps you regulate your blood sugar, helps weight management. So when you're not eating sugar, you're not putting on weight, and it helps to get rid of the extra weight. It improves your dental and oral health. Cutting down sugar reduces your risk of diabetes, non-alcoholic fatty liver disease. It helps your heart health. It can reduce acne and help your skin health, lower your risk of anxiety, depression, and mood swings, and decrease inflammation. So it's all good. There are no bad side effects. Once we get like the detox symptoms out the way, there's no bad side effects to cutting sugar.
Nice.
Yeah.
Nice. Well, as always, it's been so much fun to talk with you, Netta. And for people who'd like to have more fun with you and perhaps get some support from you in your programs, how can they find you?
They can find me on aftersugarclub.com. That's my website. They can surf around there. They can download my tips for getting rid of cravings, which again, once you cut down sugar, cravings kind of go away on their own. But at the beginning, it's an issue. It's a challenge. And they can look up my membership, the After Sugar Club, and my program as well. So aftersugarclub.com is the place to be. I'm also on social media as Life After Sugar. And of course, my podcast, Life After Sugar.
Wonderful. Well, we're so lucky to have had you here to speak with us. Thank you again for joining us. And I can't wait for us to connect again in the future. Thank you, Netta.
Thank you for having me. It's a pleasure.
Bye-bye.